over 80% of children go on to survive a diagnosis of cancer. Cure is the most probable outcome, and we celebrate this. However, around 95% of those children will go on to develop late effects, the long-term side effects of treatment, because their treatments are so toxic on their young developing bodies. It can be a recurrence or relapse. However, quite often it is the development of new chronic illness, such as cardiovascular disease or fertility issues that develop over time. And we're talking sometimes 10, 20, 30 years post-cancer treatment completion. However, this is very difficult for a healthcare system to continue to provide care for decades post the treatment of the acute illness. So part of our research, we developed personalised healthcare recommendations for survivors of childhood cancer who had been disengaged from care, and provided them to the survivor and their GP. We followed this up over time, and on average, survivors were given around 6 health recommendations. 6 months later, they could recall 2, had adhered to 1, and made up a 3rd. We don't know where they got it from. So now, whenever we make these personalised health recommendations, we ensure that we include a booster follow-up session, maybe 3 months down the track, to help them to ensure that they receive the health education that they need to know why it is so important for them to continue to pursue these health recommendations, and also troubleshoot any barriers to care, help them navigate the healthcare system. We knew that our clinics were at capacity, so we were going to have to design an intervention that triaged people to primary care. But we also knew that GPs weren't confident to manage the care of childhood cancer survivors, nor were the childhood cancer survivors confident in their GP's management. So we developed Engage, which is a distance-delivered childhood cancer survivorship intervention. The design is that we have developed a very thorough health and lifestyle assessment that systematically works through all of the body systems, as well as mental health, health behaviours, fertility, family history, a number of other things that are very important in understanding their current health needs. So we've run 2 trials of this, a pilot and then 2 trial studies. One was for all childhood cancer survivors, and the other was for brain cancer specifically. Since brain cancer often does have those poorer outcomes, we needed to be confident that this could be effective in perhaps one of the trickiest scenarios, especially as it is distance delivered. We wanted to feel really confident that nothing would be missed in that remote setting. Our studies have included around 200 participants, but that's the population that we're having to build the healthcare system for. Australia has around 20,000 child and adolescent survivors, so it's just a matter of staffing and budgets.
Okay. Time will